Welcome to C3s International Seminar. Please mute your microphones, but you're very welcome to today's seminar, which is part of London Global Cancer Week. And this is the third time we at C3 have been part of this important week focusing on cancer. C3 is a health charity, quite a small charity, headquartered in London, but working globally. I founded C3 12 years ago. My background's nursing, and I was so shocked when I realized how small, in many ways, are the risks and the things that make it much more likely that we get ill and that we suffer from chronic disease, or as globally we call them NCDs, non-communicable diseases. And I think increasingly over that 12 years, people understand and learning to understand, certainly about the risk of smoking, increasingly about the risks that come with obesity. But many people see that as a risk to diabetes, to the heart disease, which of course it is. I think it's much less well known, the cancer risk associated with obesity. So that's why I'm particularly delighted today to introduce Andrea Ooi from Malaysia, who's come to us highly recommended. We asked our friends at World Obesity, who should we ask for this important seminar? And Andrea Ooi was their strong recommendation, and I'm delighted now to introduce her. We'll be live on the seminar and recording for an hour, but hopefully I think we'll have time for questions, but please do put questions in the chat box and we'll ask you to ask your questions of Andrea towards the end of the session. Over to you, Andrea, and you're very welcome here today. I think, Andrea, if you come off mute.
Oh, yes.
Right.
Oh, no. Okay. Thank you, Christine, for your kind introduction on me. And hello, everybody. Greeting from Malaysia. I feel honored to have the opportunity to share the information on these two major health problems with everybody here today about these two major health problems. As per Christine mentioned earlier,
so screen sharing has started. There we are. Great.
Okay. Oh, sorry. Hold on. Just didn't go back to the same. All right, so we start all over again. I just want to jump to the obesity, because I'm the obesity doctors. I'm the obesity cat. All right, we are on the track now. So I'm honored to share some information on the obesity and the cancer. As mentioned by Christine just now, these are the two major non-communicable diseases that impact the world and causing such a bad social and psycho dimension in our daily health nowadays. So obesity is defined by WHO as abnormal fat accumulation in the body that is pose a risk to the health. Since obesity can bring so much harm to our body, the American Medical Association has declared it as a disease in July 2013. This is the obesity rate by a country in 2021. This is the latest data that I can find. And Malaysia is where I come from, the arrow, that's where I come from. And looking at the map, almost more than half of the world is in the obese stage now. And Malaysia is very known for the past 30 years as the fattest Asian. Our obesity rate is composed of 15.6%. So what is cancer? We keep on talking about cancer and cancer. Everybody know about cancer very well. And the term is very common and very familiar to everybody. But cancer actually is a disease of the cell that progress as a result of abnormal proliferation. The growth of the cells that has become so uncoordinated, and it can cause harm to the effect of the other tissues, and it's eventually cause the death of the host cell. So looking at the world ranking of the cause of the death, it is one of the leading cause in the country lighted in the blue. Cancer is the leading cause, and the second leading cause in the light blue color, which means that about 100 over country in the world, cancer has been remained their leading cause, and its majority happen in the developed country. And the cases and deaths in the world area, Asian have almost half of the mortality death from the cancer, almost 50%. And the cases of the incidence of the cancer also is quite high in the Asian population. And looking at the causes of the cancer in both sex, female breast cancer is still the leading cause of the cancer in the world nowadays, secondary to the lung cancer, but the majority of the death from the cancer is caused by the lung cancer, followed by the colorectal cancer. Whereas in a male, the lung cancer is more common, followed by the prostate and the colorectal cancer. The main cause, leading cause of the cancer that caused the mortality is the lung and liver, followed by the colon cancer. And it is well known that female breast is very common, breast cancer is very common, and cervix cancer. These are the two female most feared cancer for every woman, and breast cancer basically can attack 1 in every 4 women. And the majority of the death in the woman is also caused by the breast cancer and lung cancer. Most probably because nowadays more of the female are become smoker due to the social economy. So how is now we are going into how can the cancer form in the body. In our body, we have trillions of cells which undergo a normal cell cycle every day with the DNA duplication. But 2 main genes that affect our cell cycle is tumor suppression gene and tumor oncogene. If there is any stimulus to these 2 genes causing it to mutate, and the mutation activates the tumor suppression gene, which is the gene that prevent the cell to become cancer cell. So it's called tumor suppression gene. So when the mutation develops, the mutation inactivates all the DNA gene, and more of the mutation of the gene create the oncogene. Oncogene is the gene that causes the cancer cell to form. So once the cancer cell form, it's doubling in times, and finally a mass of tumor develop, and the cancer clinical manifestation develop, and people start getting to know, oh, they have disease. That means cancer is a slow disease to start with, but once it's being diagnosed, it can be progress so fast because the cell doubling in time become 4 to 8, 16 to 32. So why is it the cancer cell is so hard to kill and our body defense mechanism cannot get rid of them? Because they are the psychopaths. They are like a crazy people, you know. They just do whatever they like. They will just invade to the surrounding tissue. They cannot undergo a normal cell cycle, dying, what is called the apoptosis, and they can create their own new vessel to have their own blood supplies. No, they are immortal basically. So they keep on colonize and go into another part of the body and cause harm to the body. You know. So coming back to our body is basically made of the muscle, fat, bone, and other vital parts of the body. And when we talk about the body weight, we basically every morning when you wake up, you weigh your body. It's only tell you overall body weight. It actually doesn't tell you what is your fat and what is your muscle. Okay, so I will let you know why it is important to differentiate the two other than the body weight. By definition, according to a lot of the big association, WHO, NHS, and all that, we still use the body mass index, which is the height divided by the square or power of 2 as our indicator of obesity. So you can see there is two criteria. WHO is for the world criteria and the Asian criteria. The reason is because there is a limitation of the BMI as a measure of the total body fat. That's one thing. And it cannot be estimate the muscle. You know? And the reason for this difference is you have a look at these two experts. Both Yanji and Yuki are both obesity experts. One is in Pune in India, one is in London, UCL. They are the obesity expert. Whatever happened is, Yanji is a marathon runner and have a healthy diet. How about Yokin is staying in Pune, you know, and he is a vegetarian, but he won't do much of the exercise. They both have the same BMI, but the Dow X-ray absorption matrix of the body fat show that the Indian counterpart has a more body fat because the Asian has a higher percentage of body fat as compared to the Western counterpart, according to the same age, sex, and the BMI, which is why we have the two different criteria for the BMI, Asian and the WHO criteria. Another simple indicator to tell us that we have either excess body fat or not compared to our muscle. Instead of using the BMI, we use the abdominal circumferential, which is called waist circumferential. It's measured from your nipple level, and it can tell us whether your visceral fat is more. Or this is the operating picture. The yellow one indicate your visceral fat. This is the fat that bring a lot of harm to your body. This is the fat that causing the metabolic disease like hypertension, diabetic, and cardiac problem. Okay, so why is it important? From the International Diabetic Federation, it tells us that for a healthy man and woman, their waist circumferential should be, man should be around 90, for a woman should be around 80. The high waist circumferential is associated with increased risk for diabetic, cholesterol problem, hypertension, and cardiovascular disease, especially in the range of the BMI not so obese type. So looking at it, obesity, everybody know obesity is I eat more, do less exercise. But the actual fact is not as simple, because to regulate the obesity, there is many factors come into play: hormonal, psychologically, and neurologically come into the pictures. So it is a long chronic problem, right? So what is the causes of the obesity in the rise for the past almost 40 years due to the change of the social economy, and mainly is also individual factor like the genetic, which is quite rare, about 1%. And then the diet, don't forget you are what you eat, and the medications, the hormone pills that people taking nowadays, as well as the sedentary lifestyle, lack of physical exercise, and the stress lead to the lack of the sleep. This will influence your hormones and leads to many eating disorder also, and also the addiction problem, alcohol, drugs addiction, and environmental factor is mainly like social environment, and this have to do with our health policy. Although that we have been telling people, okay, you shouldn't eat fast food and it's bad for you, but there are always McDonald's sign, KFC sign in front of the school. This is a very bad health policy that the health authority must take into account of it, you know. So how about the causes of the cancer? Actually, the cancer also caused by the individual, like especially the age, you know, your obesity is one of the major causes. This is individual, and then the environmental is like the UV light exposure, and then viruses stand for a very less, occupation, occupation, you know. Then the causes of the, it has been well known that there's 13 cancer has been known to be associated with the obesity, you know. So the systemic review from the latest study said that obesity is completing factors for overall and cancer specific mortality, recurrence in various cases treated with a curative extent, and a disease-free survival. Means that the patient who have been cured from the cancer, but they still stay as a disease-free period is very less, you know. Another one is the obesity paradox. It's surprisingly that they found that obese people with lung cancer, renal cancer, and melanoma have a better survival than those who is non-obese, you know, unexplained. And then obesity also interfere with our management, you know, especially the correct dosage of the chemo drugs. And what's about the link of the diabetic, because obesity also causes diabetic, right? So diabetic also associated with 5.7% of all cancer incidents in the world. And the pool study found that diabetic was associated with significant increase in mortality for most cancer, you know. Then how about the causes of the cancer? What actually stimulate the changes in the obese people for the normal cells to become cancer cell? Because our body with the excess fat is in a stage of chronic inflammation. It means our inflammatory cell keep on doing their job, you know. Then the insulin will be high because the excess fat causing the insulin resistance, and then you have hyperinsulinemia, and then insulin growth factor 1 and insulin increase in insulin. These are the factors that can cause cancer. Estrogen especially is important in causing the menopausal breast cancer in female. And our adipokine is our fat cell. It secretes various hormones. It's like our endocrine, you know. These hormones will affect our energy balance, growth, immune system, and another one is the outer intestinal bacteria that cause the alteration in the gene to form a cancer cell. Okay, so come to the treatment of the cancer. We have a curative therapy. That means we have the intention to cure the cancer. What we have is the surgery chemotherapy, radiotherapy, targeted therapy for the cancer cell, hormonal therapy, or combination of the above. Another one is when the patient come to us too late, we will go for the palliative therapy, which is to relieve the symptom and make the patient feel better and have a better quality at their end stage of their life. So we can also do a palliative surgery, palliative chemotherapy, radiotherapy, or psychological support for the patients. Right. So to handle or treat the cancer patient, it needs a multiple team approach. You know, the core member consists of oncologists and oncology surgeon, especially, and pathologists, radiotherapists, you know, others like palliative care, physician, medical student, psychologist. Is very important to give a patient a psychosocial support. So looking at the rate of the growing of the obesity, childhood obesity has been increasing, and in future, it will grow into the adult. And with the obese adult, the cancer risk has been increased. And with the cancer, diabetic, obesity, and the interrelated factor, you know, causing the cancer more, and then more difficult to cure, especially the cancer burden is predicted from 2024 to increase about 30-fold. So this will present a perfect storm for our public health crisis. So we have to do some preventive medicine now. Right? So how do we prevent? Of course, environmental, we were trying to prevent it, the radiation, UV radiation. Behavior, less alcohol, less tobacco, and another one which is most treatable is the overweight or obesity, right? So there are the studies has been showed that obesity with a cancer and the potential role of intentional weight loss in preventing cancer incidence by a Swedish obese subject. They have a 10-year, almost 11 years follow-up. It showed that those who have undergone the weight loss, they have about 40% reduction in the cancer incidence. And another retrospective studies involved also about 8,000 people with a mean follow-up about 7 years. It showed a 60% decrease in the cancer mortality associated with the bariatric surgery. So we have to treat our obesity, right? So how are we going to do? What are we going to do? So it's also a team approach, multidisciplinary team approach. So the treatment, we can have a lifestyle intervention, pharmacotherapy, intra-gastric balloon, or bariatric surgery. You know? So this is our team. Our patient come from overseas, and then we have me, our anesthetist, endocrinologist, obesity physician, psychologist is very important in support us, you know, and our case manager, patient coordinator, our physiologist to make sure they have a right exercise, and our dietitian. Our aim is to have a safe surgery or whatever procedure that we do on our candidates and a good results for them, right? So this is our patients also came in and then happily dying in the Australia now, you know. So we talk about the lifestyle intervention. Lifestyle intervention consists of caloric restriction, exercise, and pharmacology and behavior therapy. In the lifestyle intervention, exercise and the diet is very important. I always stress to my candidate who come to me, whatever modality of the treatment or program that you are taking up, exercise and diet is a must. To have a must in the diet and exercise change, you have to change your behavior. So we talk about the diet is mainly reduction of the food intake. There are many kind of like diet available in the market, but I will just tell you what is important is actually the calories that is important rather than the what type of diet that you are taking. You know, we are not talking about the like you have only like low fat, but you have a high protein, but at the end your calories is the same as the previous one. It doesn't serve any purpose, you know. And the exercise will improve your heart, cardiovascular health, promote weight loss, and it's able to maintain your lost weight. So the intensity and the duration of exercise is important. So far about the pharmacology, we have oral medication, we have the injectable medications, the most recent being approved by the, actually not recent, about more than 7 years. We use the almost as our GI, gastrointestinal type of the hormone to stimulate the decrease in appetite, you know, and the internal fat loss. Behavior therapy is very important. In here, my psychologists will come into the pictures, you know. We have a connective behavior change therapy. We have to treat their, modify their habit of eating, the snack eating, watching TV while snacking, you know, then encourage them to go for the activities and change the thought that obesity can be relieved if you actually take care of it, you know, right? And okay, look at this lady. She has come to me with a complaint of the joint pain. So she's too scared of the surgery. So we give her a lifestyle intervention. You know, 12 months she reduced some weight, and 18 months she looked perfectly well. And then she disappeared from me. And 2 years later, she come back. You know, so this is a problem with the weight loss. The weight loss, I always say, weight loss is a dynamic process that we need to keep on vigilance, and it need a cooperation with the team member and the candidates as well. They always think they have lost weight, they forget about us. And intra-gastric balloon, look at that. Everybody, when we talk about intra-gastric balloon, they always say, how can you put the balloon into my mouth? How? So actually it's not a balloon, it's a tube as per shown here. So once it's inside that, we will inflate it. See, it's a tube. It's like a tube. I attach it with the endoscope and insert through the mouth. It's a daycare procedure, right? This is our lady with a successful balloon treatment after 6 months. So talk about the phases of the obesity treatment. People always think about lost weight. They always think they want to lose weight, but nobody actually think beyond the lost weight. What will happen when you lost weight? It's a phases called weight loss maintenance. When you stop the treatment, the weight regain. This is always the problem because, as I mentioned, weight loss is a major object that it's interplay with a lot of things, you know, like you have to take care of your behavior, and it's involved your hormone, your mindset, your neurology. When you see the food looks so good, smells so nice, eat it first. We will think about it tomorrow. You know? So the WHO and National Institute of Health have recommended that the obese adult who have a BMI of more than 30, or those who is 25 to 30 with any medical problem, they should at least lose 10% of their weight. And the diabetic prevention program and look ahead, I think these two are from UK, you know, they conclude that the weight loss can improve comorbid condition, and with a modest modest weight loss, even when followed by the weight regain, it can benefit for a long term because it can cause reduction in the occurrence of the diabetic and cancer, right? So we talk to my major, my specialist field. So bariatric surgery is actually a various type of the procedure performed on the obese patient for the purpose for them to lose weight and in order to maintain or regain their health. So this is our another candidate, an old man. He think he want to stay a longer life to play with his grandchildren. So he fly from Brisbane to see us. And then we give him the treatment and then he has gone back and he sent me his pictures. He is almost 72 now. He called me, he already retired. So what is the benefit of the bariatric surgery? It can cause sustained weight loss, and not only that, you become more beautiful. And then it can resolve and improve the underlying medical problem, resolving your diabetic, respiratory dysfunction, cholesterol problem, hypertension, and the 5-year morbidity comparison is prevent any medical disease from happening, and cancer is the one that we are talking about and the most concerned. And it's also improved the quality of life. And this is a very sad story for this Rick Nupali. He is known as the biggest man in the world. His living daily is around his bed. He has been taking care of his, have been taken care by his wife, and they've been planning for the bariatric surgery. But at the end, he committed suicide due to the depression. So after the surgery, when the medical problem resolved, your medication taken will be less or none. So the most important thing is the reduced mortality. Looking at that, you see the complications of the obesity happen from the head to the toes. But after successful bariatric surgery, your quality of life improved in 95%, and the mortality is 89% reduced in 5 years. This is what? One treatment to cure all. I always say, this is the only treatment that you can use money to buy your health. When you have a cancer, the internal environment have changed, and you will still remain obese, but you do not lose weight, your cancer will be recurrent. And especially when people who have a heart disease, they gone for the cardiac bypass, but the problem that causing the heart disease is remaining there. They do not reduce their weight, they do not change their habit, so they can have another heart attack again in few years' time. This is our youngest patient. She's now 17. So our team is not only to help people transform their life, but I would like to share a lot of the information and especially cause the public awareness, So I've gone around to give the talk, and I'm so happy that I gone to London in 2014. Right? And we also have our outdoor activities, but because of the current situation, the pandemic, our outdoor activity has been suspended. And sadly enough that more of the obese patient has on the rise due to the current situation. With that, I'm completing my talk. Thank you and stay safe, everybody.
That's great. Thank you very much, Andrea. And really relevant to us at C3. And I wanted to pick up on one particular area that you commented on, and I'm sure there are already some comments in the chat. So please put some more questions and comments in the chat. So we at C3 are working in an EU project called Aspire in areas of southern England and northern France, where people worked in heavy industry and had traditionally heavy diets. the industries have often moved away, but people haven't changed their diet. And so they're now faced with unemployment, poor prospects of employment, and obesity together. And I think those sorts of issues can be seen in many parts of the world. And I wanted to pick up your comments about the environment, one of many, because you're so right. Obesity is complex. There's no simple magic solution. But we at C3 work with a community engagement program that works with people to look at the environment. How easy is it to live healthily where you are? And there are big differences in different parts of our country, different parts of the world, in terms of how easy is it naturally to find healthy food? How is it naturally to be physically active? So that's some of the areas we at C3 are really interested in. But there's a couple of comments in the chat, and I'll invite people to give their own comment. So Steve, who's really Sarah, and there is a way of changing your name, Sarah, Steve, but please.
Sorry, I'm not very good at this computer lark.
Well, I'm not very good, but there are magic things called 3 dots, and they seem to give you the key to do lots of things. So
they do everything.
So please ask your question to Andrea.
Thank you, Christine. Good morning, Dr. Ooi. Thank you so much this morning for your talk. It was really, really interesting. You do so much good work, and I know that bariatric surgery really does help so many people. But in my job, I work with people. I'm a weight loss life coach, so I work with people who are real emotional eaters. And I'm seeing more and more clients who have regained the weight after this surgery. And when they do that, it leaves them with so many other mental health issues, and agoraphobia is one of them, you know, where they don't want to leave the homes anymore. Because they feel like, I've regained this weight after the surgery, everybody knows, and they feel so low self-esteem. And I wondered how you thought about actually, you know, we as a world spend more money on social subscribing, working with emotional eating, and focusing a lot more work on that and the reasons why they use food really to soothe themselves through any type of emotion that they're going through.
Yes, this is the problem that we are facing over here as well. Like what you mentioned, they regain their weight after the bariatric surgery. Because I always find is education and the knowledge on what they are going to do on themselves is very important. Yeah. Because people always think, because we can always see people do advertisement on the bariatric surgery, before, after, but they never know. Most of them, they do not know what to expect after the bariatric surgery. Yeah. You know, they always think in their mind, I go for surgery, I will lose weight. But I can tell you, without a proper follow-up, you will lose weight, and then you will lose both your muscle and your fat. And you will look so haggard, and you look so ugly, you know. So what we always counsel them, even before the surgery, we already tell them, okay, after the surgery, what are your phases of diet is going to be? What kind of exercise that we are going to help you in? This is the main important thing. And I always wash my hand. If after surgery, your weight loss result not good, it's my team member, not my problem. I'm only a mechanic. I always tell them that, you know?
Fair enough, fair enough.
All right, my job is just to do the surgery so you can't eat more. But mind you, because why is it that there will be the initial weight loss? Because it's really caloric restriction. And initially you really cannot, but after sometimes, as time go by, especially after 2 years, you always see this problem. 3
years. Yes, the clients that I bet after 3 years, they seem to then start the regain.
Correct. So because your body has come to the hemostasis, back to your previous situation, So they have to understand. This one, I will start talking to them 1 year after the surgery. So they will watch their mind. I will tell them your weight will regain after 18 months.
Yeah.
So it's always like that. You will see the curve coming down and then you're going up a while and then you maintain. Is it?
Yeah.
So they have to make the preparation. The first 18 months for us with them is very close because we want to modify their eating habit, exercise habit. Some people that you do really have to go to for the bariatric surgery because they can't do any more exercise. And with that, they've got excited and they start exercise, and exercise has become part of their life now.
Absolutely.
So with another thing is they tend to lost with the follow-up. They default their follow-ups, So once they already get to know what can be eaten, what cannot, what is good for them, they can cheat. What I call is cheating. They can go and eat drinks, the Starbucks coffee every day, which is a very high calories. Although they cannot drink so much, they cannot eat so much, maybe sometimes after 3 years, they also can't even finish a hamburger. But they can go and
find
take the
replacements. They'll start eating like slider burgers, which is the smaller ones, and they just eat them more regularly.
Sarah, calm down because we've lots of people waiting to ask.
Sorry,
okay,
Your enthusiasm is great.
That is the problem with them. So we have to make them understand about this problem. First we will have to relook into your diet, your exercise habit. About how is your behavior changes, and especially like what you said, they go into the depression. Actually, when you get them back to the track, tell them it's not the end of the world. They can lose weight very fast.
Absolutely.
Andrea, there's lots of questions
coming
for you. So,
Evan
Lee, are you able to ask your question?
Sure. So, the intermittent fasting, that's something that I've done myself. And I see that Sarah could have a discussion about that because I think it's not as well known in Europe. But, the work of Dr. Jason Fung out of Toronto, Canada, I see, has been very impressive, and really showing that it's in some ways, it's more difficult than bariatric surgery because it's not a one and done thing. But at the same time, it's sustainable, but it needs the right support systems, support groups. I mean, Sarah, you know more about it than I do, but just curious as to what the role of that is, because diets, and you showed on your slides very eloquently, some people will then gain back the weight. So that's one question. And my second question is just, the social expectations is also a factor. I mean, people talk about the lifestyle is related to obesity, but I personally think, being an American living in Europe, that social expectations play a big role. What is considered acceptable? And in my comment, I noted a BMI of 23 or 24. Nobody notices you in the US, where they think you're thin, actually.
Too thin.
In Europe, that's more considered normal. So I think there's a whole power about the social expectations, what's acceptable, that kind of sets the psychological set point. And I see more nodding there from Sarah.
Thank you. Thanks. And Andrea, as you answer that one, we've next got questions coming from Michaela Nuttall and from Harriet Rumgay. But Andrea, if you can respond to Evan Lee first.
Actually, I'm sorry. I didn't really get his question. I'm sorry.
Oh.
So his real question was, I think it's more a comment about the difference between, do you think the intermittent fasting, do you have comments on the intermittent fasting, I think is
right.
question.
Yes.
And the second one was just about how obesity can be influenced by social expectations, what you see around you.
Sure.
Is what's acceptable. What's acceptable in one country versus what's acceptable in another setting. It kind of creates this set point.
And I think those are comments and really part of the discussion. So Michaela, if you ask your question, and then Harriet.
All right.
Hers.
Okay. So regarding the intermittent fasting, I know it can cause the weight loss, but about the sustainability is a question to me. How I always asking is like, how long can the patient keep on doing this? Are we going to do it in the how to say rest of your life? You know, and is also at the end of the day, if you still go out of track, I will still go back to the calories that counts. You know, and another question is your social environmental. Okay, how is the people looking at it? Okay, we talk about the people. Most of the people that they are really having some psychological problem, especially the depression and the lack of confidence in a female. You know, and some of them, they will manifest and they will let us know. Some of them, they will just keep to ourselves, you know. So everybody come in, we will give them a psychological evaluation. And the most worrying, actually, you're talking about environmental, is childhood obesity. The reason that we have such a young girl come for the surgery is because she already refused to go to school, has been bullied by the teammate. So this is a very important social psychological people. The people look at you, ayo, that is so fat. That is another one is like some people, like just now Steve mentioned, they become so obese, they don't like to go out because once they go out, they have to think which chair I can sit, you know, in the restaurant, they can't fit in. It's a daily life that is incapacitated them, causing them to have all this psychological problem, right?
Yeah, and thank you. And Michaela, and then Harriet, please.
So I'll just give mine into a little bit of context. So bariatric surgery, my daughter had bariatric surgery just about a year ago, and it has been life-changing, absolutely life-changing on her physical health, but also on her mental health, emotional health that way. But it's not an easy journey. Often people think, oh, it's really simple. You just have this bit of surgery and it's done. It's actually a very complex surgery that every day you have to live with the impact of that choice you've made, and it affects everything. You know, you have to think about every item you put in your mouth, when you're going to drink. It really, having watched it, I've seen this huge roller coaster. So it's been really, really interesting to, you know, obviously it's great to see, but it's been really interesting to see it from a sort of clinical perspective. And so I guess my question is, I'm loving the instant results I'm seeing for her, but actually the longer term results and the health benefits, particularly in relation to cancer now, how often do your patients get to really understand the impact it's going to have in the longer term as well? You know, what is do you get to discuss that with them? Are they keen to know future prevention?
Right. Thank you for your question, Michelle. Actually, I must confess, I come from a developing country, which is Malaysia. My patient is more of the beauty conscious than the health conscious. They saw, oh, the actress gone for the surgery and becoming slim and beauty, they will just come for it. When you talk about to them about the consequences, they will just okay. And then suddenly after the surgery, after 6 months, they will just disappear and they will come back to you. But I have another set of the candidates who come from Western country. You know, I have people who fly in from UK as well, Canada, Australia, New Zealand. They are the person, they know what exactly they want. And with our support to them, they always give us a good results, and we always tell them, this is what you expect. What are the risks? First of all, we have to tell them the risk that is going to involve during the surgery. You know, this is the short term and the long term effect of the surgery. Let's say, may I know what surgery that your daughter has undergone?
Oh, she had gastric sleeve. She's had a sleeve.
Okay. How old is she?
She's 25 now. She had it when she was 24.
Okay, that is good. But she's still, for the gastric sleeve, normally we put them on the bariatric supplement for a year.
Oh,
And then
yeah.
after that, our follow-up will be the half yearly. After the 1 year, we will follow up with the half yearly. The reason is when we talk to them, we will know that this is going to get rebounds weight gain or not by looking at the way they tell you the way they eat and all that. So we will explain to them the problem, long-term problem. The sleeve major long-term problem will be the gastroesophageal reflux disease. She will have the burping and all that. And another problem is make sure that she has a balanced, healthy diet. I always say balanced, healthy diet in a moderate amount, so that she won't run into the vitamin deficiency like vitamin B and the iron deficiency. You have to watch out for those who go for the sleeve surgery around three years. After 3 years, the iron may be low. Another problem in the Western country is the vitamin D deficiency. You have to watch out.
Luckily, she's on.
Thanks, Michaela. Because we're running tight for time. The very last question from Harriet, who's showing needs to unmute. Thank you very much. The last question, because we try and end at the right time. But thanks, Michaela, for the question, and Andrea Ooi for the answer. Harriet, over to you.
Yeah, thank you so much for the talk. It's really interesting. I was wondering if you had more information on cancer risk after weight loss. So does the excess risk stay high for some cancers, or does it return back to the risk of a person with healthy weight? And also, does it differ much by sex, so for males or females?
Okay, as per I mentioned just now, there are 2 studies. They actually mentioned that after the surgery, you really have a reduction in the cancer rate, but I do not have the data on the sex difference. But even if you go back to the normal weight, don't forget about your environmental and your habits. Especially I mentioned about the virus is one of the cause of the cancer. The HIV can cause a carpoxysarcoma for the female, for the male especially, and human papillary virus can cause cervix cancer in the female. So it's very important. Individual kind of the cancer, they also have their own individual risk. Like why is the lung cancer is so major? If let's say the person already come back to a normal weight, but he start smoking and he start consume alcohol, can get a risk of the lung cancer, and alcohol is the risk of the liver cirrhosis, at the end liver cancer.
Thank you. Thank you all for those questions, for being such an engaged audience. We will share the recording, and we'll make sure some of the references that people have asked about are clear for everybody. Please, if you're not already joined to the C3 network, please do join. Our next international seminar is on December the 14th, and it will come from the other side of the world, so the time will be very different. It's coming from the Caribbean, and while the subject sounds very different, in many ways it's a natural follow-on. It's about healthy environments and health empowerment, lessons from the Caribbean. So thank you all very much. Have a good rest of the day, evening, night, depending on where you are. And thank you for joining C3 today. Bye.
Thank you, everybody.